sort of a new movement that's arisen in the doula community called the full spectrum doula movement, I guess you could say. And those are people who are doulas who provide support to women and to people across the spectrum of pregnancy. So doula, the doula movement kind of arose, I think probably in like the 60s and 70s, as a response to, in many ways, the deficiencies of our healthcare system. Our medical system does a terrible job of supporting people and supporting patients. People have really, really a tough time. And so doulas kind of came about. Doula is a Greek word. It means like woman helper, and it was sort of adopted by this movement and created in this particular role of like support person. And people have been supported in labor their entire, throughout existence, right? But never in like a formal capacity in this way. So that's sort of where doulas came about. And so the full spectrum doula movement is about using the doula model of care, which is supposed to be non-judgmental, emotional, and psychological support for folks across the spectrum of pregnancy. So I work now as a volunteer abortion doula. So I work as a doula with folks having abortions in a public hospital in New York City. And I think that the skills that I have as a birth doula, I've worked in the past with folks giving birth, it's not that different, right? The setup is different. The amount of time I spend with them is very different. The circumstances may be different, but the skills I'm using are very, very similar. I'm part of providing support. I'm holding hands. I'm listening to someone talk about their experience. And there's a lot of emotion that happens in abortions, but there's a lot of emotion that happens in birth. And the emotion is not always from, and I wrote about being an abortion doula recently on my blog, and it was interesting to see the responses from people, because people are making a lot of assumptions about what these women were experiencing during their abortions and why I was supporting them. And a lot of people were assuming that it was all about sadness, right? That this was a really hard decision for everyone and that it was really, really sad. And there's a lot of sadness and there's a lot of emotion, but it's not always about the abortion. One woman that I recently supported, was crying during her procedure, and I sat in the recovery room, which is kind of the place where most of my support happens in the abortion context, and just sat with her while she was coming out of the medication and just listened to her for an hour talk about what was going on. And she wasn't sad about the abortion, she was sad about the way she's treated in her life. She was sad because her partner disrespects her, because her kids don't respect her, because she has a difficult family situation, she's an immigrant in the United States. There's a whole litany of reasons why she was upset. It wasn't about the abortion, and she actually wasn't having an elective abortion. She was having a procedure because her fetus no longer had a heartbeat. So people have these assumptions about what does it mean to have an abortion and who has abortions, like Lynn was pointing out. And this woman was not electively, choosing to terminate a pregnancy. She had a pregnancy that had terminated itself, essentially, right? A miscarriage. And it's the same procedure that you had, and she's in the same context. So, I think the role of the doula, and in terms of developing to address the deficiencies of the healthcare system around childbirth, is not that dissimilar from why we're doing it in an abortion context either. There's a lot of problems with the way we do healthcare, even abortion care, even in places like Planned Parenthood. Whether it's because of funding problems, because of overcrowding, because providers that's not what they're there to do, people don't get a lot of support. So it's not because abortions need more support than other things. I don't think that's the point. I think it's that, everybody can benefit from that in the healthcare system overall. And so, I think that's kind of where the full spectrum doula movement, and the reason that I do this work and I call myself a radical doula, is a political choice, right? I'm making a political decision to try to talk about why these two things make sense, why it makes sense to support people in childbirth and makes sense to support people in abortion, why they're the same women, why it's the same philosophy. I want to do that. I want to call myself an abortion doula because I want to push the pro-choice movement and the birth movement around these two issues. But it's not because abortion needs support more than anything else necessarily. It's our healthcare system. And so we support people, like I said, during childbirth. We also support people giving up their kids for adoption, which is not something that's talked about a lot. We work with a pro-choice adoption agency in New York City. Pro-choice adoption agency. Wrap your mind around that, right? And the reason that they're pro-choice, in that they're not encouraging people not to have abortions, this is a side note and then I'll wrap up. 80% of their birth moms choose to keep their children. They're an adoption agency where 80% of the women who come to them decide, actually I want a parent. So one of the reasons they're pro-choice is because they work with their birth parents to make sure that that's the decision that they want to make. They actually want to give up their child for adoption. So if you go to their agency, you know that if you get a child from that agency from a birth parent, it's because they wanted to give up their kid. that to me is a radical, radical thing. So they contract doulas from the program I'm a part of called the Doula Project in New York City to provide support to those women giving up their kids for adoption, because those women need different types of support because they're not going to be parenting their kids necessarily. So, so abortion, adoption, people who want to parent their kids, birth moms, miscarriage. So it's across the spectrum, and it's really about trying to have a broader sense of kind of what it looks like to provide support to people and how to kind of bridge this sort of divisiveness that we see. So I'll stop there. Thank you.